Shawon Gullette, and you're here at the Dayton Trichology Hair Loss Control Clinic. Today I'm going to be working with the patient that's dealing with diffuse hair thinning. She's dealing with diffuse hair thinning as a result of medications that she's taking. She's taking several different medications that are creating deficiencies within her body. So I want to kind of let you look at what I do as a system in terms of finding out what the root cause of her hair loss is. The first thing we do is a really in-depth consultation. The consultation is going to deal with a urine and saliva analysis. It's going to deal with looking at your blood work. It's going to deal with a body compass check, and also a lifestyle analysis and a dietary evaluation. The next thing I'm going to do is I'm going to look at blood work. Blood work is going to tell me several different things. It's going to tell me whether your iron levels are low, whether your ferritin is low, whether your vitamin D levels are low, whether you're dealing with thyroid, diabetes, and things of that nature. The next thing I'm going to do is I'm going to form a really good etiology as to what's causing your hair loss, looking at the root cause of the problem. Secondly, we're going to find that we're going to form a prognosis. How long is it going to take to regain the normal thickness that you had? We're going to develop a treatment plan. We're going to do a scalp assessment to make sure there's no inflammation, there's no buildup on your scalp. One of the first and most important things I do is I do a detox. A detox will help me with any type of inflammation that you're dealing with from an internal standpoint that could be slowing down the growth of your hair. We also look at doing oxygen scalp therapies to actually infuse elixirs into the scalp. And then we do what's called laser therapy. Some of these or all of these some of these points are always used, or some of them are not used, but in any type of consultation, this is the gist of what I look at and give you a really good etiology as to what's causing your hair loss. So sit back and look at me do a consultation with the patient that's dealing with diffuse hair thinning. Today I'm working with the patient that has what's called diffuse hair thinning. What you can tell with the difference with diffuse thinning and other patients that you've seen me use or demonstrate with is that there's not a difference in the density from the crown all the way to the nape. There's the same exact amount of hair. What has happened is that for some reason their hair follicles have actually started to constrict and miniaturize, and so the hair actually gets thinner. The hair is not receiving the amount of nutrients that it needs to receive. So with this patient today, I'm going to do a couple things. What's important is that I first see blood tests. Blood test is going to tell me a story as to what's going on inside the body. I always tell patients that hair is an indication of what's going on inside the body. For example, if you have a really nice bed of flowers and the roses are really pretty and red, you can tell that there's some really good things going on beneath the soil. But if the flowers are really limp, they don't have that really bright red color, there may be some things that underlying beneath the soil. I use the same analogy for when I'm dealing with patients. We have to see what's going on in the body. As women, we have a lot of things that can be going on. It could be hormones, it could be medications that we're on, it can be different products that we're using, it can be high stress levels, it can be our diets. So like I mentioned before, the first thing I do is a blood test. After I do the blood test and make sure that the body has what it needs, one of the things I do is I use a dermoscope to see exactly where she's at in the miniaturization process. So what I'm going to do is actually look at her hair follicles to make sure there's first not any inflammation around the hair follicle, and that's really important. About 80% of the patients I see, they do have inflammation. So I'm looking to make sure she doesn't have any inflammation. So as I'm looking at my patient's scalp, she doesn't have any inflammation in this area. I'm going to move more towards the occipital to see if she has any inflammation and to see once again where she's at in the miniaturization process. Now that I have achieved that, the next thing I'm going to do is I'm going to compare the different areas of the head that I've taken photos. One of the things I would like to do at this point, since I've actually looked at her hair follicles, I've actually looked at her scalp, I made sure she didn't have any miniaturization. And in the areas where she had mild miniaturization, I'm going to actually do a recommendation to help reduce some of the inflammation that she does have around that particular hair follicle or in that area of hair follicles. The next step I'm going to do is I'm going to actually use a device to find out the percentage of hair loss that she has accumulated, so that I'll know what my job is as a trichologist in terms of getting her hair to regrow. Now that I've done the basic part of the consultation, I've looked for miniaturization in her hair follicles. I've actually looked to see how much of her hair follicles have actually started to thin. Now I need to know the percentage of thinning that she has experienced in relation to her whole entire head. So what I'm going to actually do is go in and test to find out the density loss. And so I use a device that helps me determine how much hair she's lost. And it actually gives me a reading. And it takes it all the way out to the end. Okay. It tells me exactly how much hair she's lost. What's important when doing this is that I'm able to get a true reading. So when I go back months from now, I need to be able to go to the same exact area. And so this device helps me to go to the same exact area of the head to find out, is her hair really growing? What's important is that you're just not going to someone that's telling you your hair is growing. You need to know that you're going to the same affected area of the scalp to get that accurate measurement that the hair is actually growing. Now, since I have actually documentation of the area, the amount of hair that's thinning, the density loss, I'm going to actually proceed with the treatment that's going to help my particular patient today in aiding her into getting her hair back the normal thickness that she would have. One of the things that I've determined with this particular patient is that she's dealing with diffuse thinning. Diffuse thinning just simply means that she's thinning all over the whole entire scalp. So one of the things you have to find out is what's causing that. So as a trichologist and a naturopathic doctor, it's my goal to find out what is the root cause of her thinning. One of the main things that cause thinning is actually nutritional or mineral deficiencies. So as I look on my chart, and just to give you an example of one of the things that can cause thinning, if you look at copper, for example, if your body's deficient in copper, one of the first things you're going to experience is alopecia. So a lot of times I have patients that are experiencing thinning, and they have a lot of different mineral deficiencies that cause that type of thinning, and my goal is to find out what deficiencies they have. So now we're going to start the treatment that I have treatment plan that I put together for Wanda. Wanda's going to do a series of things, a series of different therapies. What I'm going to start off with is a really good scalp exfoliation. This particular scalp exfoliation that I'm doing is one that's actually a homemade regimen. So I'm going to actually take some capsules and drop the capsules right down into the treatment. This is a really strong exfoliation. There are several different types of exfoliations that I use here in the clinic, depending on the type of hair loss, the type of scalp condition, and what are the desired results. Now, since I have applied the scalp exfoliation, I'm going to actually give my patient a really nice steam treatment to open up the hair follicles and allow it to penetrate. The next step in our process of actually helping Wanda to regain her normal thickness is we do have the scalp exfoliation on her scalp. The next step I'm going to do is I'm going to actually put a nice hair mask on her hair. As you can see, her hair is really dense. So I want to start building her hair up. So I want to do some things internally and externally. And I'm going to just apply the mask from her scalp all the way out to the ends of her hair shaft. Now I'm going to put Wanda under steam therapy to help open up her hair cuticle and allow it to penetrate from her scalp and also for her hair. So now I'm actually going to finish up the last step of Wanda's therapy. We're going to use high frequency rake to increase blood circulation. Blood circulation will then encourage hair growth. Actually, make sure I get the hairline. And that concludes Wanda's therapy for today. So I've kind of finished the treatment, and I look back at what's causing her hair loss. One of the first things I noticed is that her iron levels are really low. When your iron levels are low, it causes a thinning. I also noticed that she's very deficient on vitamin D. Vitamin D can also cause thinning within the hair. She has several medications that she's taking, that she has to take, that is creating a deficiency within her body, and it's also causing her to have diffuse thinning. So we'll do some things internally that's going to create a balance internally. We're looking at her pH levels, whether her body's breaking down foods really fast or really slow. Secondly, we're looking at her body in terms of her nutrition and what she's taking in. If she's taking enough proteins, or if she's not taking enough proteins. The third thing we're looking at is we're making sure that we're creating a balance externally. We're making sure that she has the nutrients that she needs from an external standpoint and the treatment that she needs from an external standpoint. This process is going to be a process that takes a while, because we have to make sure things are balanced internally. Once we get those things together internally, we'll look at getting her hair to grow, and not only grow, but go back to her normal thickness. So each time she comes into the clinic, I'll actually take photos from a digital standpoint and a microscopic standpoint to compare and make sure that her hair is actually growing. So stay tuned for more information and more updates on her diffuse thinning.